Your body is running low on something right now, not energy in the conventional sense, not willpower or motivation, but actual molecular building blocks that your cells need to function properly. These are micronutrients, vitamins and minerals that your body cannot produce on its own, and the deficiency is affecting how you feel, how you think, and how well your organs are working at this very moment. The concerning part is that nutrient deficiencies don't announce themselves with dramatic symptoms. They develop gradually over months or years, creating a constellation of vague problems that most people attribute to stress, aging, or just feeling run down. By the time you notice something is genuinely wrong, the deficiency has often been affecting your health for so long that it has created secondary problems in multiple organ systems. What makes this particularly frustrating is that modern medical practice is not set up to catch these deficiencies early. You go to your GP complaining of fatigue or brain fog, and unless the deficiency is severe enough to show up on standard blood work, which it often isn't, you get told that everything looks normal and perhaps you should reduce your stress or get more sleep. Meanwhile, your cells are struggling to perform basic metabolic functions because they lack the cofactors and substrates required for energy production, neurotransmitter synthesis, immune function, and tissue repair. I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the A&E, I've seen what happens when chronic nutrient deficiencies progress to the point of causing acute medical crises. My goal now is to help people recognize these subtle warning signs early, understand what's actually happening at a biochemical level, and take action before minor deficiencies become major health problems. Over the next several minutes, I'm going to walk you through 11 symptoms that indicate your body is quietly running out of essential nutrients. These aren't random complaints. These are specific clinical manifestations of known biochemical deficiencies, and understanding the connection between symptom and nutrient is the first step toward fixing the problem. And if you're watching this video, there's a good chance you're experiencing some of these symptoms yourself. So let me make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research to help you understand what's happening in your body and how to optimize your health. All I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time or you've not learned something new, then feel free to unsubscribe. No hard feelings, but if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue. The first symptom is something that affects almost everyone at some point, but rarely gets properly investigated. It's when you experience persistent fatigue that doesn't improve with rest or sleep. You're sleeping 8 hours a night, you're not particularly stressed, and yet you wake up feeling like you've barely slept at all. You need coffee just to feel functional in the morning, and by mid-afternoon, you're struggling to keep your eyes open. This specific pattern of fatigue, particularly when it's accompanied by weakness and reduced exercise tolerance, is often the first sign of iron deficiency. Here's what's happening at a cellular level. Iron is an essential component of hemoglobin, the protein in your red blood cells that carries oxygen from your lungs to every tissue in your body. When iron stores are low, your body can't produce enough hemoglobin, which means your cells aren't getting adequate oxygen delivery. Without sufficient oxygen, your mitochondria cannot run the electron transport chain efficiently, which is the primary mechanism for producing ATP, the energy currency of your cells. The result is that you feel exhausted because your cells literally cannot generate energy properly. The key distinction here is that iron deficiency develops in stages. The first stage is depleted iron stores, measured by ferritin levels, which can cause fatigue long before you develop anemia. The second stage is iron-deficient erythropoiesis, where red blood cell production becomes impaired. And the third stage is iron deficiency anemia, where hemoglobin levels drop below normal. Most people don't get tested until stage 3, which means they've been functionally impaired for months or years before diagnosis gets there. Who lose iron through monthly bleeding, vegetarians and vegans who don't consume heme iron from meat, which is far more bioavailable than plant-based iron, and people with digestive issues like celiac disease or inflammatory bowel disease, which impair iron absorption. Clinically, this shows up as low ferritin, low serum iron, high total iron binding capacity, and eventually low hemoglobin and low mean corpuscular volume. The fatigue is your body telling you that oxygen delivery is compromised, and if you ignore it, you're not just tired. You're setting yourself up for cognitive impairment, immune dysfunction, and reduced physical capacity. The second symptom is something you might blame on screen time or stress, but is actually a neurological sign. It's when you develop muscle twitches, particularly in your eyelids, calves, or fingers. These aren't seizures or spasms, they're fasciculations, brief involuntary muscle contractions that happen randomly throughout the day. You might also notice muscle cramps, especially at night, or a general sense of muscle irritability where your muscles feel tense and don't fully relax. This constellation of symptoms points directly to magnesium deficiency. Magnesium is required for over 300 enzymatic reactions in your body, but one of its most critical roles is regulating the electrical activity of nerve and muscle cells. Your nerves communicate with your muscles through electrical signals that depend on precise concentrations of minerals like magnesium, calcium, and potassium on either side of the cell membrane. Magnesium acts as a natural calcium channel blocker. It prevents excessive calcium from entering cells, which would otherwise cause continuous muscle contraction. When magnesium levels drop, calcium flows into cells unchecked, causing hyperexcitability of the neuromuscular junction. The result is twitches, cramps, and spasms. The reason magnesium deficiency is so common is that modern diets are depleted in this mineral. Soil depletion from industrial agriculture means that even whole foods contain less magnesium than they did 50 years ago. Processing removes magnesium from grains, and stress, caffeine, and alcohol all increase magnesium excretion through the kidneys. The groups most at risk are people with high stress levels, heavy exercisers who lose magnesium through sweat, people on diuretic medications, and anyone consuming a diet high in processed foods. The clinical challenge is that serum magnesium, which is what gets measured in standard blood tests, is a poor marker of magnesium status because most magnesium is stored inside cells, not in the bloodstream. You can have normal serum magnesium and still be functionally deficient. The gold standard is red blood cell magnesium or ionized magnesium testing, but these are rarely ordered. The muscle twitches are your nervous system telling you that mineral balance is off. And if you don't address it, you're at increased risk for arrhythmias, high blood pressure, insulin resistance, and migraines. The third symptom is a cognitive change that most people dismiss as normal mental fatigue, but is actually a sign of neurochemical imbalance. It's when you notice persistent brain fog, difficulty concentrating, and a general sense of mental sluggishness that doesn't improve with coffee or rest. You find yourself reading the same paragraph 3 times because the information isn't sticking. You walk into a room and forget why you went there. You struggle to find words in conversation even though you know exactly what you want to say. When this pattern is accompanied by low mood, lack of motivation, or mild depression, it often points to vitamin B12 deficiency. B12 is essential for the synthesis of myelin, the insulating sheath that wraps around nerve fibers and allows electrical signals to travel quickly and efficiently. Without adequate B12, nerve conduction slows down, which manifests as cognitive impairment and neurological symptoms. B12 is also required for the synthesis of neurotransmitters, including serotonin and dopamine, which regulate mood, motivation, and cognitive function. The mechanism of B12 deficiency is important to understand because it's not just about dietary intake. B12 absorption requires a protein called intrinsic factor, which is produced by cells in your stomach lining. If those cells are damaged, either by autoimmune attack as in pernicious anemia, by chronic use of proton pump inhibitors which suppress stomach acid, or by infection with Helicobacter pylori, then you can't absorb B12 even if you're consuming adequate amounts in your diet. The groups most at risk are vegans and vegetarians, because B12 is found almost exclusively in animal products. Older adults over 60, because intrinsic factor production declines with age, people on acid-suppressing medications, and people with autoimmune conditions. The clinical assessment involves measuring serum B12, but also methylmalonic acid and homocysteine, which are metabolites that accumulate when B12 is low. The brain fog is your nervous system telling you that neurotransmitter synthesis and nerve function are impaired, and if you ignore it, B12 deficiency progresses to irreversible neurological damage, including peripheral neuropathy, balance problems, and cognitive decline. The fourth symptom is something that affects your appearance and your immune function simultaneously. It's when you notice your hair is thinning more than usual, your nails are becoming brittle and developing vertical ridges, and your skin is dry and taking longer to heal from minor cuts or abrasions. These three tissues, hair, nails, and skin, are all rapidly dividing tissues that require constant nutrient supply for maintenance and repair. When they're all affected together, it often indicates zinc deficiency. Zinc is required for DNA synthesis and cell division, which means any tissue with high turnover is particularly vulnerable to zinc deficiency. Hair follicles go through rapid growth cycles, nail matrix cells divide constantly to produce new nail tissue, and skin cells turn over every few weeks. Without adequate zinc, these processes slow down. Hair growth slows and more follicles enter the resting phase, leading to diffuse thinning dot. Nail growth slows and the nail plate becomes brittle. And skin cell turnover is impaired, leading to dryness and poor wound healing. Zinc is also critical for immune function. It's required for the development and function of white blood cells, particularly T cells and natural killer cells. Zinc deficiency impairs both innate and adaptive immunity, which is why people who are zinc deficient get sick more frequently and take longer to recover from infections. The mechanism of zinc deficiency is multifactorial. Dietary intake may be insufficient, particularly in people who avoid red meat and shellfish, which are the richest sources. Absorption can be impaired by phytates in grains and legumes, which bind zinc and prevent its uptake. And certain conditions, like inflammatory bowel disease or chronic diarrhea, increase zinc losses. The groups most at risk are vegetarians and vegans, people with digestive disorders, heavy alcohol users, and older adults. The clinical marker is serum zinc, though this is also an imperfect measure because most zinc is intracellular. The hair, nail, and skin changes are your body telling you that cell division and immune function are compromised, and if you don't address it, you are at increased risk for infections, poor wound healing, and progressive hair loss. The fifth symptom is a specific type of muscle weakness that's different from general fatigue. It's when you notice difficulty with tasks that require sustained muscle contraction, like climbing stairs, getting up from a low chair, or lifting objects overhead. Your muscles feel weak and heavy, and the weakness is particularly noticeable in your proximal muscles, your thighs, shoulders, and upper arms. When this is accompanied by bone pain or a general sense of achiness, it often indicates vitamin D deficiency. Vitamin D is not actually a vitamin, it's a steroid hormone that regulates calcium metabolism and has receptors in virtually every tissue in your body, including muscle cells. In muscle tissue, vitamin D is required for proper calcium handling, which is essential for muscle contraction. Without adequate vitamin D, muscle cells can't generate force efficiently, which manifests as proximal muscle weakness. Vitamin D is also critical for bone health because it regulates calcium absorption in the gut and calcium deposition in bone. Low vitamin D leads to secondary hyperparathyroidism, where the parathyroid glands ramp up production of parathyroid hormone to maintain blood calcium levels by pulling calcium out of bone. Over time, this causes osteomalacia in adults or rickets in children, which presents as bone pain and increased fracture risk. The reason vitamin D deficiency is so widespread is that most people don't get adequate sun exposure, which is required for vitamin D synthesis in the skin. Dietary sources are limited to fatty fish, egg yolks, and fortified foods, which most people don't consume in sufficient quantities. The groups most at risk are people living in northern latitudes, people with darker skin who require more sun exposure to synthesize vitamin D, people who spend most of their time indoors, and older adults whose skin becomes less efficient at producing vitamin D. The clinical assessment is straightforward with a 25-hydroxy vitamin D blood test. Levels below 30 nanograms per milliliter are considered insufficient, and levels below 20 are deficient. The muscle weakness and bone pain are your musculoskeletal system telling you that calcium metabolism is disrupted, and if you don't address it, you're at increased risk for fractures, falls, and progressive muscle weakness. The sixth symptom is a bleeding tendency that most people don't connect to nutrition. It's when you notice you bruise more easily than you used to, particularly developing large bruises from minor bumps that wouldn't have caused bruising before. You might also notice that when you cut yourself, the bleeding takes longer to stop than it should, or your gums bleed when you brush your teeth, even though you have good dental hygiene. This pattern points to vitamin C deficiency. Vitamin C is required for the synthesis of collagen, which is the structural protein that provides tensile strength to blood vessel walls, skin, tendons, and connective tissues throughout your body. Without adequate vitamin C, collagen synthesis is impaired, and the collagen that does get produced is weak and unstable. This causes blood vessels to become fragile and prone to rupture, which manifests as easy bruising and prolonged bleeding. Vitamin C is also required for the cross-linking of collagen fibers, which gives tissues their structural integrity. The reason vitamin C deficiency still occurs in developed countries, despite scurvy being considered a disease of the past, is that modern diets are often low in fresh fruits and vegetables, which are the primary sources of vitamin C. Cooking destroys vitamin C, and processed foods contain almost none. The groups most at risk are smokers, because smoking increases vitamin C requirements, older adults who may have poor dietary variety, people with alcohol use disorder, and anyone following a highly restrictive diet. The clinical presentation of severe vitamin C deficiency is scurvy, which includes not just easy bruising, but also petechiae, small red spots caused by bleeding under the skin, perifollicular hemorrhages around hair follicles, and eventually tooth loss as the collagen in the gums breaks down. But these severe manifestations only occur after months of complete vitamin C depletion. The easy bruising you're experiencing now is an early warning sign that collagen synthesis is already impaired. The clinical assessment involves measuring serum ascorbic acid, though levels can fluctuate significantly based on recent intake. The bruising and bleeding are your vascular system telling you that collagen structure is compromised, and if you don't address it, you're at risk for more serious bleeding complications and poor wound healing. The seventh symptom is a nighttime vision problem that many people blame on aging or screen time. It's when you notice difficulty seeing in low light conditions, particularly when driving at night or walking into a dark room from a bright environment. Your eyes take longer to adjust to darkness than they used to, and you find yourself struggling to see clearly in dimly lit spaces. This specific pattern of impaired night vision, particularly when it's accompanied by dry eyes or dry skin, often indicates vitamin A deficiency. Vitamin A is essential for the production of rhodopsin, a light-sensitive pigment in the rod cells of your retina. Rod cells are responsible for vision in low light conditions, and they require a constant supply of vitamin A to regenerate rhodopsin after it gets bleached by light exposure. When vitamin A is deficient, rhodopsin production is impaired, and your rod cells can't function properly, which manifests as night blindness. Vitamin A is also critical for maintaining the health of epithelial tissues, including the mucous membranes of your eyes, respiratory tract, and digestive system. Deficiency causes these tissues to become dry and keratinized, which is why vitamin A deficiency often presents with dry eyes alongside night blindness. The mechanism of vitamin A deficiency in developed countries is usually related to fat malabsorption rather than inadequate dietary intake. Vitamin A is a fat-soluble vitamin, which means it requires dietary fat for absorption. Conditions like celiac disease, inflammatory bowel disease, chronic pancreatitis, or bile duct obstruction can all impair fat absorption and lead to vitamin A deficiency, even if dietary intake is adequate. The groups most at risk are people with digestive disorders affecting fat absorption, people following extremely low-fat diets, and people with liver disease, because the liver is the primary storage site for vitamin A. The clinical assessment involves measuring serum retinol, though this is also an imperfect marker because serum levels are tightly regulated and only drop when liver stores are severely depleted. The night vision problems are your visual system telling you that retinal function is compromised, and if you don't address it, vitamin A deficiency progresses to xerophthalmia, severe dry eyes that can lead to corneal damage and blindness. The eighth symptom is a specific type of numbness and tingling that has a characteristic distribution. It's when you notice pins and needles sensations or numbness in your hands and feet, typically starting in your toes and fingers and gradually spreading upward in a glove and stocking pattern. The sensation might be constant or it might come and go, but it's progressive over weeks or months. When this is accompanied by balance problems or a general sense of unsteadiness when walking, it often indicates vitamin B6 deficiency or in some cases B6 toxicity from excessive supplementation. B6, also known as pyridoxine, is required for the synthesis of neurotransmitters and for the metabolism of amino acids. It's also essential for maintaining the myelin sheath around peripheral nerves. Both deficiency and excess of B6 can cause peripheral neuropathy, though through different mechanisms. Deficiency impairs myelin synthesis and nerve function, while toxicity causes direct nerve damage. The deficiency form is less common in developed countries because B6 is widely available in foods including poultry, fish, potatoes, and bananas. However, certain medications interfere with B6 metabolism, particularly isoniazid, used for tuberculosis treatment, and chronic alcohol use depletes B6 stores. The toxicity form is more common than most people realize because high-dose B6 supplements, often taken for conditions like premenstrual syndrome or carpal tunnel syndrome, can accumulate and cause nerve damage. Doses above 100 milligrams per day taken chronically have been associated with sensory neuropathy. The mechanism involves damage to the dorsal root ganglia, the nerve cell bodies that process sensory information from the periphery. The groups most at risk for deficiency are people with alcohol use disorder, people on certain medications, and people with malabsorption syndromes. The groups most at risk for toxicity are people taking high-dose supplements without medical supervision. The clinical assessment involves measuring plasma pyridoxal 5-phosphate, the active form of B6. The numbness and tingling are your peripheral nervous system telling you that nerve function is impaired, and if you don't address it, the neuropathy can become permanent. The 9th symptom is a specific type of mouth and tongue abnormality that points directly to nutritional deficiency. It's when you notice cracks at the corners of your mouth, called angular cheilitis, that don't heal with regular lip balm. You might also notice that your tongue becomes smooth, red, and painful, a condition called glossitis, or that you develop recurrent mouth ulcers that take weeks to heal. This cluster of oral symptoms is characteristic of B vitamin deficiency, particularly B2, riboflavin, B3, niacin, and folate. The reason these deficiencies affect the mouth so prominently is that the tissues of the oral cavity have high cell turnover rates and are therefore particularly vulnerable to nutrient deficiency that impair cell division and tissue repair. Riboflavin is required for energy metabolism in rapidly dividing cells. Deficiency causes inflammation of the mucous membranes, leading to angular cheilitis, glossitis, and a magenta-colored tongue. Niacin deficiency causes pellagra, which presents with the classic 3Ds, diarrhea, dermatitis, and dementia. But early signs include a bright red, swollen tongue and mouth ulcers. Folate deficiency impairs DNA synthesis, which particularly affects rapidly dividing cells like those in the oral mucosa. The tongue becomes smooth because the papillae, the tiny projections on the tongue surface, atrophy. The mechanisms of B vitamin deficiency are diverse. Dietary intake may be insufficient, particularly in people following restrictive diets or consuming primarily processed foods. Absorption can be impaired by celiac disease, inflammatory bowel disease, or chronic alcohol use. And certain medications, particularly metformin and some anticonvulsants, interfere with folate metabolism. The groups most at risk are people with alcohol use disorder, people with digestive disorders, vegetarians and vegans for B2, and older adults who may have poor dietary variety. The clinical assessment involves measuring individual B vitamin levels, though these tests are often not included in standard blood panels. The oral symptoms are your mucous membranes telling you that cell turnover and tissue repair are compromised, and if you don't address it, the deficiencies progress to more serious neurological and hematological complications. The 10th symptom is a specific pattern of skin changes that dermatologists recognize immediately as a nutritional marker. It's when you develop rough, scaly patches on your skin, particularly on the backs of your arms, thighs, or buttocks. The patches feel like sandpaper and often have small bumps that look like goosebumps, but don't go away. This condition, called keratosis pilaris or follicular hyperkeratosis, is often a sign of essential fatty acid deficiency, particularly omega-3 fatty acids or vitamin A deficiency. The mechanism involves abnormal keratinization of hair follicles. Normally, skin cells at the opening of hair follicles shed naturally, but when essential fatty acids or vitamin A are deficient, these cells become sticky and plug the follicle opening, creating the rough, bumpy texture. Essential fatty acids, particularly omega-3 fatty acids like EPA and DHA, are critical components of cell membranes throughout your body.